My name is Mark Yabyub, and I'm one of the veterinary program coordinators for the 12th Annual Pre-Medical and Pre-Health Science Professions National Conference. I'd like to first off thank our AAMC sponsors for allowing our conference and our recording panels to be broadcast globally. I'm honored to have the opportunity to introduce one of our keynote speakers, Dr. Ted J. Cohn. Dr. Cohn is the current president-elect of the American Veterinary Medical Association. He's always been a leader in the veterinary medicine from the time of his veterinary school days when he represented Tuskegee University in the Student American Veterinary Medical Association House Delegates, to his work as president for both the Denver Area Veterinary Medical Society and the Colorado Veterinary Medical Association. Prior to his election as president, Dr. Cohn served and chaired several task forces and committees focusing on the role of veterinarians and strategic planning for a better economic future. Aside from his leadership and advocacies, Dr. Cohn is a practicing veterinarian. He began his career as an associate veterinarian at Aspenwood Animal Hospital. Next, he took a position at University Hills Animal Hospital, where he has been a partner and hospital director. For his incredible veterinary service, Dr. Cohn was named Western Regional Practitioner of the Year by the American Animal Hospital Association, AHA, an organization which he has been active for over 35 years. More recently, Dr. Cohn graduated from the certification course in veterinary acupuncture at the College of Veterinary Medicine and Biomedical Sciences at Colorado State University. On a final note, he's also a very fascinating individual, and we are grateful for his presence among us today. Without further ado, please join me in welcoming Dr. Ted J. Cohn.
Thank you very much. I don't think I've ever been called fascinating before, so not even by my wife, so I appreciate that. Okay, let's see if we can get this up here working. Are we going to have PowerPoint? Well, good morning, everybody. Well, let me just tell you while we're playing with this thing, I'll let them go ahead and play with that, and we'll get started. Everybody doing well? Is everybody, are there any current veterinary students here, or are you all pre-vet students? Anybody not there's one lone veterinary student. Congratulations. You probably should be studying. Okay, looks like we've got that going. Well, as you heard, I am a companion animal and exotics practitioner from Denver, Colorado, and it really is a pleasure to be here with you today. And I'll tell you, it's been a heck of a long time ago. I mean, it really has been a long time, many years. But I do remember sitting pretty much where you're sitting today and thinking about, what do I want to do with my life? And it took some thinking, it took a lot of planning. And I'll tell you, I was nervous. I was thinking, how will I ever learn everything I need to know? I only want to be the best veterinarian I can possibly be, no pressure there. I was worried, am I going to be smart enough? Will my classmates be so much smarter than I am? And better than I am. And I was scared. I had animals' lives, people's beloved pets, animals upon which they depended for a livelihood were going to be under my care. I was wondering, was I really up to that awesome responsibility? I didn't know. Do I have what it takes? Any of you feeling like that today? Nobody. That's great. Well, I'll tell you, I was also thrilled, and I knew I was taking an absolutely critical step towards realizing my dreams of being a veterinarian. And all of my hopes and all of my aspirations and all of my insecurities were whirling around my head the day I set foot on the campus of Tuskegee University School of Veterinary Medicine in Alabama. And that's what it looks like today. It definitely didn't look like that 45 years ago, 44 years ago, but it's a pretty cool place. When I got there, I did realize that the journey I was embarking upon would not be easy. And you know, I was okay with that. Because, you know, if it was going to be easy, guess what? Anybody could do it. And if anybody could do it, why would they bother to call you doctor? So, I am honored to be here today and being part of the exploration of medical and health professions here at UC Davis, which is, as you are very well aware, home to one of our nation's premier veterinary colleges. It's exciting to see and to face so many bright young minds, and you guys are all gathered in one place. I was totally blown away at the pavilion with 10,000 screaming fans. It was just amazing. So this is great. You know, I find veterinary medicine to really be a constant stimulation for me, and has provided me personal rewards without measure. And I think it will do the same thing for you if you decide to pursue a career in this, what I think of as absolutely the best profession. Now, when I meet with new veterinary students, I always remind them that they've got the right stuff. And I'm sure that you do too. And I tell them that by making it as far as they've made it at this point, when they're first in veterinary college, they've proven their talents and their intelligence, because it isn't easy to get into veterinary school. Traditionally, the number of students applying for veterinary school outnumbers the available seats by about a ratio of 2 to 1. Not too bad. You guys are smart enough. The other thing is, veterinary education isn't cheap. Unfortunately, like any other professional degree program offered across the country, the cost to students, both resident and non-resident, continues to climb. This creates challenges for all of us, to you, to our veterinary schools, and for society in general. Now, you may think I'm trying to scare or deter you from pursuing a veterinary education and career. Believe me, I am not. But I do have to be honest. When I am in my clinic and I diagnose a patient, my job, my responsibility is to be forthright with my clients about their pet's health. I take that responsibility very seriously. I am here to inspire you to possibly pursue a career in veterinary medicine, but I'm also here to be honest and to guide you to a career decision that is both good and right for you. If it is truly right for you, if you have a passion for veterinary medicine, you should also have a plan. You should know that it's going to take some blood, some sweat, a few tears, and money. If this is something you want, be realistic about what you'll have to do to get the investment you need in terms of time, energy, and financial resources. But remember that you can make a good living and, perhaps most importantly of all, make a difference in the lives of both animals and people. So, how did I get here today? Well, let me ask you, that's me. I had a little more hair then, maybe a lot more hair. But let me ask you, how many of you want to be a veterinarian because it's just, I want to go out and just do some great research and discover new things? And how many of you are here because you think, I really want to protect the food supply of the world? And how many of you are here because you read James Herriot and you fell in love with that lifestyle? Okay, well, my path was probably a little different than most of yours. What got me into veterinary medicine, I can't talk, excuse me. As a boy growing up in Arkansas, I was always interested in science, I was always interested in medicine, and I always had a love for animals. What began for me as a journey into a possible career as a research scientist actually took a turn in a different direction when I realized I wanted to work with animals and that I had started to develop a passion to keep them not just alive, but healthy and happy. Today, nothing has changed. As a practice owner and companion animal practitioner in Colorado, I relish the opportunity every day to be able to work with dogs, cats, birds, reptiles, a variety of small mammals, and even tarantulas and other rather unusual pets. Lately, I've branched out by learning to help my patients through the use of veterinary acupuncture. You know, and that right there is absolutely one of the coolest things about veterinary medicine. It's variety. When you graduate from veterinary school, your degree will allow you to administer to all types of animals, every kind of animal species imaginable. All of this takes me to one very important message that I hope to leave you with today. Keep your options open. Veterinary medicine is more than companion animal practice in an urban area. In fact, it is so much more. Let's take a look now at what veterinarians have done and what they continue to do as they help animals and people. Okay. Veterinarians have created better solutions to meet the changing needs of society by creating some of the first artificial limbs, improving the hypodermic syringe to make injections easier, producing the reduction splint to heal broken bones, implanting the first permanent artificial legs, and even constructing the first air-filled tire. How about that? Veterinarian invented a tire. All right, we can do more than give shots to cats. Veterinarians have also aided in advancing technology and medicine by pioneering advancements in the field of bacteriology, performing genetic research, discovering the first strain of Salmonella and West Nile virus, proving insects can transmit disease, and then learning how to prevent and treat those diseases, and determining how the body's immune system protects them from disease. Every day, veterinarians around the world work to care for both animals and people by developing new techniques to detect, prevent, and treat diseases. Further, they work daily to help humanely produce an abundant, wholesome, and above all, safe supply of food. We have an ever-expanding and ever-demanding population in this world, and in fact, by 2050, the population will probably increase by another 2 billion people. That's going to take a lot of veterinarians working with animals that produce food. Think about that. Veterinarians monitor our lakes and rivers to ensure the water is safe to drink, keep our pets and working animals healthy, work to discover new ways to restore and protect endangered species, and are globally engaged in public health programs. While veterinarians have to know about all species, the challenge, of course, is what? Our patients can't speak to us. They can't let us know how they're feeling. But you know what? Veterinarians are problem solvers. We take the unknown, break it down into understandable bites, and we build puzzles. And sometimes we even have to build the puzzle pieces themselves. And in that way, we do solve medical mysteries that affect a variety of our patients and various creatures. Veterinarians, however, can't and don't do this noble work alone. The best veterinary healthcare teams are built around a solid foundation that includes veterinary office managers, veterinary technicians, various types of assistants, and oftentimes many other folks. I do urge you, beyond thinking of being a veterinarian, to consider all of the various career choices as a member of the veterinary healthcare team. Everyone is essential, just as much as the veterinarian, and they help ensure that we are advancing animal and human health. You know, it doesn't stop there, however. Veterinarians also work in the public policy arena at all levels of government. They work for international groups like the World Health Organization and the United Nations, and they work in the corporate world helping develop new medications and drugs and to improve medical technology for animals and humans alike. Now, I've been talking a lot about animals and humans, and I'll tell you, I think this is really the coolest thing. It's really the most exciting thing to me as far as veterinarians' role, and that is our role in One Health, which is a movement that is grounded in a long-standing foundation, but one that has only recently really begun to bloom. One Health, if you're not familiar with that term, deals with the interface between animals, humans, and the environment, and trying to make sure that they're all healthy and learning and realizing that they are all interdependent. The One Health initiative, of which the AVMA, the American Veterinary Medical Association, is a proud commission member, is a movement trying to forge inclusive collaboration between the diverse array of professionals, including physicians, osteopaths, dentists, veterinarians, nurses, and environmental scientists. The AVMA is just one group that has joined the One Health Initiative. We partner with other groups such as the American Medical Association, American Academy of Pediatrics, American Nurses Association, Centers for Disease Control and Prevention, the United States Department of Agriculture, and the U.S. National Environmental Health Association. Our goal is to advance healthcare for the 21st century and beyond by accelerating discoveries in biomedical research, enhancing the effectiveness of public health, expanding the scientific knowledge base, and improving medical education and clinical care. When fully implemented, the One Health approach to medicine holds the promise of protecting and saving countless human and animal lives in both the present and future generations. Pretty cool, huh? Yep. We're stuck. It says, where did the cursor go? It's trying to download a program and restart. The cursor went away. That's all right. Veterinarians also play a vital role for associations like the American Veterinary Medical Association, which I now proudly serve as this year's president. The AVMA and other veterinary groups in each state and around the world represent the interests of veterinarians across all professional disciplines. The AVMA just celebrated our 150th anniversary, and we are more than 85,000 members strong. We continually engage in a wide variety of professional activities dedicated to advancing the art and science of veterinary medicine and protecting the welfare of animals. Through our accreditation activities, we are committed to ensuring that veterinary students receive the best possible education, and we advocate to Congress on behalf of our members, and we pride ourselves on our public outreach trying to educate and inform citizens of this country about animal and human health and welfare and food safety. Now, I'd like to read to you in a minute the veterinarian's oath. This is a vow that's taken by every new veterinary graduate upon his or her graduation. This oath is our guide for all that we do as veterinarians. So, being admitted to the profession of veterinary medicine, I solemnly swear to use my scientific knowledge and skills for the benefit of society through the protection of animal health and welfare, the prevention and relief of animal suffering, and conservation of animal resources, the promotion of public health, and the advancement of medical knowledge. I will practice my profession conscientiously, with dignity, and in keeping with the principles of veterinary medical ethics. I accept as a lifelong obligation the continual improvement of my professional knowledge and competence. That's it. Wow, did you know veterinarians had an oath? Yeah. Okay. So, who knows? Maybe someday you too will be able to take that oath and you'll join the ranks of what I definitely believe is the noblest of all professions. If you do achieve the goal, after all of your studies, after your own experiences with nervousness, worry, and fear, you will have followed your passion and achieved your dream. You'll prove all to yourself and to others that you have what it takes, and all those that you serve will then be able to call you doctor. Thank you. I don't know if we have any time to answer questions, or we can do that later. No time? Well, I will be around all day. Don't hesitate to come up and talk to me. I don't bite, and happy to try to answer any questions that I can. Thank you very much.